I'm Lynn Sterling. I am a generalist obstetrician gynecologist, and I actually started at Humber 6 years ago as a senior resident. I then came on as staff, covering maternity leaves, and came on permanently 4 years ago. Yes, so as an OB GYN, I get to look after women's health through their entire reproductive years. And this is interesting because it's different day to day. So some days I'm looking after abnormal pap tests to make sure we're not missing a cervical cancer. Other days I'm putting in birth control implants up in our clinics. Today I was in the operating room where we do procedures like removing fibroids or cysts and other problems in women's health. And other days I get to bring new life into this world by doing C-sections or vaginal deliveries. You know, I think I've always been interested in the human body and the sciences, and also working in a job where I get to interact with people and kind of see a tangible difference being made. And so I kind of gravitated towards the job of being a physician, I think for a little bit of everything. And then really in my specialty, it's just so varied. You get to have really kind of close relationships at really vulnerable times with your patients, and help them through really hard times, and make a really tangible, valuable difference. I like that I get to solve problems in different ways. You know, some days I am solving problems with my hands. I'm operating, I'm removing something that's causing bleeding or pain, and it's a really instant fix. Other days, you know, in my clinic, I have to think through someone's history and try to come up with the best medication to deal with a longer term problem. Other times I get to be a second or third opinion on a rarer issue, and get to think it through and really see a tangible difference when someone comes back and says, "You're the first person to help fix me with this issue." And then one of the most interesting ways is sort of solving the problem of how do we safely bring a life into this world? Does, you know, she need a C-section? Can we get this baby out safely in the more traditional way? I think for me, it really comes down to the people. I really enjoy working with our patients here. I think there's so much diversity, there's so much kindness and gratitude, and you know, a lot of our patients, you know, are either new to Canada or they've lived here their whole lives and are working hard to kind of find ways to show up and maintain their health and support their parents or their children, especially when you deal with kind of women at the middle of their reproductive years. So I really love our patient population, but then I equally love our team. I was just talking today with a colleague about how lucky we are that we get to work together with such a skilled group of people that are not only so capable at doing kind of hard things in our specialty, but also really supportive of each other. You know, we show up and help each other with the hard cases and tell each other we're doing a good job, or come and troubleshoot. We change things around in our busy lives to make sure we can cover someone so that they can do something that's important inside or outside of work. And this is not just our physician team, but really extends to our nursing team, our support staff team. It's just really nice to come to work and see these people every day and, you know, make these strong relationships with your work family. I think that we are really interesting because our hospital is so full of innovation, especially in OB/GYN and women's health. You know, I can't really think of another site in our city that has everything that we have. In the last, you know, even 5 years, we've created a contraception clinic for rapid access birth control. a hysteroscopy clinic, which allows women to have minor procedures done more efficiently for them in sort of a day surgery setting. We've brought forth an interesting kind of fibroid shrinking surgery that is fairly new to Canada, and we're one of 2 sites in the entire country that does this surgery. And then my kind of personal pet or baby is our CO2 laser program, which is something we've been working on for our colposcopy clinic that will allow us new, up-to-date ways to treat women's precancers safely and more efficiently. So I think our department is totally on it for innovation. Well, today is International Women's Day, and I think that I kind of have a special take on it as an OB GYN because, much of my practice, of course, identifies as female, and it's such a fun thing to have a day to celebrate the power of birth and, the ups and downs and strengths of motherhood, and the opportunity to kind of support women through all the stages of their life, easy and hard. And I think that I'm lucky in my career that I get this kind of firsthand take on how strong and awesome women are and the chance to support them.